Hello and welcome everyone. I am Sarah Smith, Acting Manager of the Viral Hepatitis and Harm Reduction Program at the HIV and Related Programs, or the HARP unit. Thank you for joining us to talk about the new and, we think, exciting hepatitis C cures. I'm joined as promised by Lisa and Di, who will introduce themselves shortly. I'm just going to do some very quick housekeeping. So everyone has been muted, and if you do have questions during the session, we ask that you use the IM or the chat function within Skype. Myself and Douglas from the HARP unit, who is in the room, will be monitoring those questions and we'll endeavour to answer those as we go. If we don't, we will follow up with answers via email. We are recording this session and we'll send you the link and upload it to the intranet for people to watch at a later date. So if you are watching at a later date, thank you for joining us. So before we begin, I'd like to acknowledge the traditional owners of the land we are working and meeting on today. We are coming to you live from the HARP unit in Darlinghurst, where the Gadigal people have been custodians of this land for 60,000 years. We thank them and we pay our respects to them and to their elders past, present and emerging. And we extend that respect to our Aboriginal colleagues joining us today. And speaking of emerging leaders, we also want to acknowledge that today is National Aboriginal and Torres Strait Islander Children's Day. And the theme this year is, we are the elders of tomorrow, hear our voice. So hearing children's voices today plays a crucial role in them becoming elders and leaders of the future. When we talk about Hep C, we need to acknowledge the very real impact of colonisation and intergenerational trauma and grief experienced by Aboriginal people. It has contributed significantly to the inequality and disproportionate extent to which Aboriginal communities have been affected by hepatitis C today. So with this in mind, we acknowledge Aboriginal people, this history and their connection to country, culture and community as part of our ongoing commitment to working inclusively to improve their health and wellbeing. And I also want to take a moment to shout out and acknowledge Tim Croft and the Aboriginal Health Unit and HARP's Aboriginal Health Education Officers, both Kevin Heath and Tara Green, for their continued work in this space. Okay, so last week was Hepatitis Awareness Week in New South Wales, which included World Hepatitis Day, commemorated each year on the 28th of July. It is one of just 9 global public health days mandated by the World Health Organization member states. So together, viral hepatitis B and C, left untreated, are the most common causes of liver cancer in Australia and around the world. But with very effective treatments for hepatitis B and C available to prevent liver damage and disease, these events provide a really great opportunity for staff and the community to become better informed about viral hepatitis, how to prevent it, test for it, treat it, and for hepatitis C, cure it. So this year's theme is a hepatitis-free future, which ties in very nicely with New South Wales Health's goal of eliminating hepatitis C as a public health issue by 2028, an ambitious target 2 years ahead of the global target of 2030. While thousands of people have already been treated here in Cessland and across Australia, many thousands have not. So our challenge now is to reach those people who may or may not know that they are living with Hep C, so we can link them to testing and treatment. All healthcare workers have an important role in helping us to achieve this goal. So again, we thank you for joining in because we believe that together we can eliminate hepatitis C. While our discussion today is going to focus very much on hepatitis C, we encourage you to visit the Hepatitis New South Wales and Multicultural HIV and Hepatitis Service websites, and we'll pop those up for you at the end. And there you'll find a lot more information about viral hepatitis B and find resources in key community languages. So now, that's it from me. For the time being, I'm going to hand over to our Hep C specialists to introduce themselves and to tell us very briefly about their roles. Lisa.
So my name's Lisa Dowdell and I'm the Community Liver CNC at St George Hospital. My role is to assess, initiate onto treatment and manage people with hepatitis C. I also give a lot of support to GPs in identifying and treating people with hepatitis C, and also one of my roles is going out into the community and screening people who may be at risk of having viral hepatitis, performing the blood test to identify them.
I'm Dianne Chow. I work out of the HARP unit at Darlinghurst in the viral hepatitis harm reduction program. My role takes me out into the community. I work with GPs. I assess people in community settings, such as within needle and syringe programs, drug and alcohol services. And more recently, you may have seen me across the Prince of Wales campus, where we're trying to find those people who do not yet know that they have hepatitis C and get them treated.
Fabulous. And both Lisa and Di are great resources across our district, and between the two of them cover a large part of the north and south, or in fact you do, and we'll pop their contact details up at the end. Okay, so before we start to talk about the treatments, Lisa, did you just want to tell us what is hepatitis, briefly?
Well, hepatitis is inflammation of the liver, and it's mainly caused through viral hepatitis A, B and C. And I just wanted to point out that they're distinctly different in the way that they're transmitted and managed, and that's really important to note, that they're separate diseases. But today we're going to talk about hepatitis C, and I wanted to mention that we have the new treatments available since 2016. They're very successful in treating people with hepatitis C, and in fact 98% of people who get treated are cured. They're different from the old medications which had debilitating side effects. These treatments have very few side effects, and that's the message we need to get out to people with hepatitis C who may not yet have heard about that and may not be willing to be treated because of this.
Fabulous. Did you want to add anything, Di? Or?
No, I think that's...
No, I think that's it. So the treatments are new, they're very effective, and they're different to the old. Okay, so how does a person know that they have been cured of hepatitis C, Lisa?
So you only know if a person has been cured from hepatitis C when we perform a hepatitis C PCR 3 months after treatment. This is the only way we'll know that they've been cured.
Right, okay. So Di, in terms of where people can get treated for hepatitis C, did you just want to run through the options?
Yeah, sure. Well, in the past, the only way was actually through a liver specialist in a tertiary centre, but now with these new treatments, the treatment is easily and readily available through GPs. So that's where we recommend people go. But the other main way is through a liver specialist clinic. But more and more treatment is more readily available through, I've already mentioned needle and syringe programs in the community, but alcohol and drug settings, mental health services as well, if there's a doctor that's there that's familiar with treatment and able to prescribe. And that's where Lisa and I come in as well, in the community, maybe at home as health services, where we're able to assess people for hepatitis C, do all of the workup and then present the case to a specialist, either at St George or Prince of Wales, and get people onto treatment. So wide variety of places.
Great. Okay, so in terms of people accessing the treatment, so the eligibility has changed somewhat. Di, could you speak to who?
Yes, so because the treatment is so easy, it's well tolerated and it's safe, everybody can be treated for hepatitis C. And now we can access treatment for people as young as 12 years old and older. And there are no restrictions. So in some countries, you have to have already developed advanced liver disease or cirrhosis to be eligible. So now there's no restrictions like that. Anyone can be considered for hepatitis C treatment.
I'd just also like to point out that people who may have missed out in the past with interferon can now be treated, and that includes people who inject drugs and also people with mental health issues, as the treatments weren't precluded them because of the interactions with their mental health issues.
Yeah. And I think that is a big change, isn't it? So in the past, people maybe weren't able to access medications if still injecting, whereas now there's no kind of restrictions or prioritisation to access, and people can be treated again and again, and we'll talk a bit later about whether people can.
Oh, it's really
Get Hep C,
important
yeah.
that people who inject drugs are treated, because they're we want to get the hepatitis C out of the injecting drug pool so that we can work towards elimination of hepatitis C.
Okay. Lovely. Okay, so moving on to pre-treatment assessment and monitoring, how has that changed, Di?
Well, we still do a lot of things that we used to do. So we're checking, we're doing blood tests, but we're also checking to see whether or not people have cirrhosis. People with cirrhosis can still be treated, however, they might have a slightly different pathway and they'd have ongoing monitoring after their treatment's completed. In the past, we used to have to organise a liver biopsy for people. Well, that's well and truly over. We can assess for liver cirrhosis using a FibroScan, and again, that's where Lisa and I can become involved, take the FibroScan out to GP practices and do those assessments there. We check for potential drug-drug interactions, so if people are on quite a number of medications, we need to make sure there's not going to be any contraindications. What else, Lisa?
Drug-to-drug interactions.
Contraception, obviously, we can't treat anyone who would be pregnant at the time, but rather we would treat them after they'd had a baby, and as long as they're not breastfeeding.
I'd just like to say that some of the monitoring is less than what we used to do with the older treatments. So there's less blood tests involved, and in actual fact, it might be just a check-in every so often to see how someone's going, and we might just see them at the end of treatment.
We want to check for co-infection with other blood-borne viruses such as HIV and hepatitis B. Again, we still want to treat those people, but again, we'd just make sure that they've been managed with those other infections.
Fabulous. So another important message for people looking at accessing Hep C treatments around no more liver biopsies if they've had kind of experiences with those in the past, and also less on treatment monitoring potentially, which is good news. Is it possible to start somebody on treatment when they are an inpatient? Now, this might differ, I'm mindful, across the different hospital sites and campuses around Cesslet. Di, did you want to start?
Okay, well, at Prince of Wales, we are looking for people across the campus whilst they're an inpatient. I'll complete all of the workup, and then we'll have a script ready for them when they're discharged, or if that's not possible, then we'll link them to care in the community and liaise with their GP with the patient's permission and get them started through the GP.
It's similar at St George, so it's a very good time to meet with those patients and form that connection with them so that they know that they can be treated. Occasionally we do start someone on treatment at St George or Sutherland Hospital, and that's if they don't have any complications with their condition that they're presented with, and these might be people that we may miss out on following up later, so they might be those who are a little bit more difficult to contact once they leave hospital.
Okay, great. Brilliant. All right, so a question here. So I did mention that both hepatitis B and C are the largest causes of liver cancer in Australia. But Lisa, did you want to talk us through a little bit more about the consequences of what happens when Hep C remains untreated for people?
Yeah, so hepatitis C is known as a silent disease, and many people with hepatitis C may not know they have it. So over a period of time, they can develop fibrosis and cirrhosis of the liver. They can develop liver decompensation, which can also lead to liver cancer and then death. So it's really important that we identify those people and initiate them onto treatment and cure before they get to this stage. The other thing too is for about 70% of people with hepatitis C, there are extrahepatic manifestations, and these can include skin disorders, renal disease, lymphoma, insulin resistance. So there are a number of complications as if you continue with hepatitis C.
But curing hepatitis C can have a huge effect on improving someone's liver health.
Definitely.
Yes? Yeah.
We can even avert some of these, and even people with advanced fibrosis will have better outcomes from being treated with hepatitis C.
Fantastic.
Hepatitis C is also associated with depression and chronic fatigue, and we see vast improvements of people's quality of life when they've been treated.
Great. Yeah. Fabulous. Okay, so with so many benefits to the individual getting treated, and with treatments for Hep C being safe and effective, what are some of the barriers that you see to people coming forward and getting tested or treated for hepatitis C, Lisa?
So there are quite a few. So people may have remembered the treatment in the past and have heard through their friends how difficult it was. They may not be aware that the new treatments are available. So it's really important that we get that message out, that treatment is simple and cure can be achieved. But mostly, many people don't like to admit they've got hepatitis C, even to their doctor. They quite often suffer from stigma and discrimination, and unfortunately some of this occurs through how they're managed in the health system. They've reported that a comment made in the past has made them realise that they're not extremely welcome in many circumstances. So it's really important that we are very aware of how we speak to people, that we don't do anything extra, such as double gloving or wearing masks or extra PPE when seeing a patient. We need to make sure that we don't disclose to other people that they have hepatitis C and keep their confidentiality. Can you think of any more, Dianne?
You mentioned double gloving, making sure that everyone has access as well to being assessed. If they ask to see somebody, then we want them to be referred to us, particularly across the campus as well.
Yeah.
And some people, some people even now stop from having treatments because they have hepatitis C. So they might have delays to surgery or other things and be denied other treatments because of hepatitis C. So we really need to be cautious how we speak to people with hepatitis C and make sure that they have a positive outcome from their health treatments.
Right. So in recognising that sadly people living with hepatitis C or people who inject drugs do encounter some stigma and discrimination within healthcare settings, what are some of the things that staff might be able to do to address that in their day-to-day work? Di or Lisa?
Well, I think it's really important that we watch the language that we use. We're particularly careful, especially around handover. We only need to mention hepatitis C if it's relevant to their admission. It's important that if someone discloses that they have hepatitis C, that we keep that confidence unless we've asked permission to disclose that.
Yes, one thing is that to know is that hepatitis C, I guess, as a condition or a label, follows that person through the health system. So it's documented in their notes, and it's often handed over at handover hepatitis C. But I would encourage you to think about the question, what does that actually mean? Does the person really have hepatitis C, or have they actually been treated and cured? Because then they don't have hepatitis C, so really becomes irrelevant. So we've mentioned how you would know that, and that is by doing a PCR test, but you might have an opportunity to have a quiet conversation with that person by saying something like, I've noticed, on your records that you may have been diagnosed with hepatitis C. Have you been treated? Would you like to see somebody? That sort of thing, so that, it gives access to...
Well, it's an opportunity for you to mention the new treatments and say, we can link you to care, and to either Dianne or myself to come and visit and give them some more education around it.
Right. Okay. And before we move on, I might just mention, as you were talking about, Lisa, the importance of non-judgmental language and the words that we use in these settings when we are talking about injecting drug use, for example. And two of the resources that we thought are worth kind of promoting are the HETI online stigma and discrimination training for people who inject drugs, and also the Language Matters resource and the Power of Words, which are two really great tools that kind of help us understand what non-judgmental language when we're talking about hepatitis C and injecting drug use looks like, and we'll pop those up at the end. Okay, so before we move on to talking about testing for hepatitis C, so just a quick question for you around how do we go about finding people who might have hepatitis C but not know it?
Oh, that's a really good question. That's where we are at the moment, and it's certainly a challenge. But we know that people with hepatitis C, everybody, accesses health services from time to time throughout their lifespan, and that may be through a GP, or it may be through an emergency admission to hospital, through drug and alcohol services and mental health services. So we're really trying to make sure that the people that are already accessing these services are having an opportunity to have their health assessed for bloodborne viruses. So it's really important. We already know we can prevent people from getting hepatitis B, so we should also, just check to make sure that there haven't been any risks for that person for acquiring hepatitis C, and then providing treatment if needed.
Right, fabulous. I'm really mindful of the time, so I'm going to move now to talking about detecting hepatitis C. So how does somebody know that they have hepatitis C, Lisa?
Well, you can't tell that someone has hepatitis C from looking at them. The only way you can tell is by doing a blood test, or actually two blood tests. So the first blood test is the hepatitis C antibody. This means that someone has been exposed to hepatitis C in the past, but it doesn't necessarily mean that they have hepatitis C. If someone does have hepatitis C antibodies, we need to follow up with a hepatitis C PCR, and that's the only way that we know if the person has the chronic infection. So
it's possible that someone can have hepatitis C, they'll be hepatitis C antibody positive, but not...
Yes, so someone who's been exposed to hepatitis C, for most people who are exposed to hepatitis C, they will go on to have the chronic infection. But for a small group of about 20% of people will clear the virus themselves. So they will just have the antibody. The other thing is that people who have had treatment in the past will still have the antibody, but they won't have the virus in their blood. So we're going to see more and more people with hepatitis C antibody and not the PCR or the virus within their blood. And this is important to note. And the way you can find out about it is just to ask the person, I notice you've got hepatitis C antibody. Have you had treatment for it in the past? And that will give an idea.
Great. Okay, so Di, a question for you. When should someone be tested for hepatitis C? And or who?
If anyone asks for a blood test for hepatitis C, then they should be provided that test. But one of the main things is the assessment of a person for risk factors. So some of those risk factors would be trying to ascertain if anyone has ever injected any substance in their lifetime, either currently in the past, or we're interested in finding people as well who might just be starting to experiment with injecting. Yeah. So anyone who's ever been in a custodial setting is at risk for hepatitis C. Aboriginal people, and people from cold backgrounds. And so we know that some countries there's a higher prevalence of hepatitis C, much higher than we have here in Australia, for example, would be Egypt, Pakistan, Southeast Asia, Mediterranean peoples, and people from Eastern Europe and Africa.
And could I just jump in and say, and a lot of that has been caused through poor sterilisation techniques. So many people were immunised, and instead of using a clean needle and syringe each time, they were mass immunised, and the hepatitis C spread throughout a number of people.
That's right, and we also had people who had blood transfusions before 1990 were at risk or exposed to hepatitis C as well. So people have travelled overseas to have, dental procedures, and they've had tattoos when they've been travelling. Sometimes this, conditions haven't been as sterile as we would like.
Right.
Also, children born to mothers with hepatitis C should be checked. Most of them will be negative, but about 10% will have the hepatitis C infection transmitted during birth. So it's important that we follow up with the children.
Okay, so I'm really mindful we might actually run over a few minutes here, but I'll just move us along to the next question, which is, and we've touched on this, but Lisa, can someone get hepatitis C again?
Yes. So being treated for hepatitis C and having the hepatitis C antibody doesn't preclude someone from getting hepatitis C again. So it's really important for people who continue to inject drugs that we make sure that we give them some health advice around clean injecting equipment. We may link them up to their local NSP. You can find NSPs by just Googling NSPs, and they come up on the computer, so you can give the directory. And also NSPs are very important because they give, not only do they give clean injecting equipment, but they also give out education and advice to people who inject. So that's an important way that we can make sure that the hepatitis C doesn't continue to get transmitted or reinfected.
Okay. And just quickly, so thinking about the people that we should test, the other ways to avoid hepatitis C transmission would be avoiding blood-to-blood contact. So we're talking, you've mentioned, Lisa, the sharing of injecting drug equipment, but also making sure that tattooing is sterile,
and the
piercing. Absolutely.
And sharing personal hygiene products such as razors or toothbrushes with someone who has hepatitis C.
Great. So a question here, can you get hepatitis C from someone who has been cured but still has the antibodies?
No, we don't pass on the antibodies, but someone who has been cured does no longer has the virus, and cure means cure. Although we know, as we've discussed, it's possible to be reinfected, so it's sometimes window periods we need to take account of, but yeah. And
possible to be retreated. We'll get that message out there again.
Yeah.
Okay, so a question here, what should I do if a patient's notes say they have hepatitis C? And again, I think we've covered this, but just quickly.
Just standard precautions, don't need to do anything special. Otherwise that can reinforce stigma. You could, if you felt comfortable, you could ask them about their hepatitis C. As mentioned, you could ask them if they've ever been treated. But if you don't feel comfortable, then maybe give us a call, ask the patient if they'd like to see somebody to have a chat about liver health.
And Dianne, I was just wondering if you wanted to talk about maybe if someone on the ward has a needle stick injury from someone who has had hepatitis C, what should they do?
Be more experienced in this than I am. Look, everybody should be wearing gloves, and everyone's got their infection control guidelines. We should follow those. Obviously, IMS is very important. The risk of transmission of hepatitis C is very, very low, very negligible. and they should, follow the infection control guidelines.
Yeah, so reporting the incident, and also anxiety is the most common. It's very unlikely that the person will contract hepatitis C, but anxiety around the needle stick injury is the most cause of upset for staff who have had needle stick injury. So you can see counselling from your staff health or through HEP New South Wales. They have a chat line which is confidential. But the most important thing to alleviate that concern is to know that hepatitis C can be treated and cured if that person did contract in the unlikely event that they contracted hepatitis C.
Fabulous. Just looking at our last three questions that we have here, did we have mentioned that patients, clients don't need to disclose their hepatitis C status to workers? Yes. Did we want to add anything more around that, Lisa?
We didn't actually talk about that. So people with hepatitis C don't really need to disclose that they have hepatitis C. There's only a few situations where someone does, and that's if they're joining the Defence Force, if they're seeking life insurance, or if they participate in some sports where there's blood involved, such as boxing or football, etc. And the reason I say that is just to remind everyone that we don't know who is infected with a bloodborne virus, so we just use standard precautions with everyone, and that will keep us safe.
Brilliant. Okay, second last question. Is there a vaccination for Hep C, and should I be vaccinated against hepatitis B? Right.
So unfortunately we don't have a vaccination for hepatitis C, but we can cure hepatitis C. There is a vaccination for hepatitis B, and everybody should be vaccinated against hepatitis B, and in fact it's a condition for all healthcare workers. It's interesting to note that actually there's no cure for hepatitis B. We can manage it, but we can't cure it. So two two viruses, but very different.
Right, okay, and the very last question that I have here, and I will check the chat, is if a patient has been cured of hepatitis C, can they give blood? Who wants to take that one? Lisa?
I will. So unfortunately not, and a lot of people who have had hepatitis C are quite keen to give back, but unfortunately they can't because they continue to have the hepatitis C antibody. And while that doesn't mean that they have the hepatitis C virus, the blood at the blood bank is screened using the hepatitis C antibody. Organ donation is possible too for people who have hepatitis C. It's really important to know. And often their organs are given to another person with hepatitis C in life-threatening situations, and then afterwards the hepatitis C is treated. But for blood donations, no, they can't do it.
Great. Okay, so that brings us to the end of the questions. There's no further questions on chat. Was there anything that you just wanted to add, any kind of burning thoughts, key messages you wanted to pass on to healthcare workers before we wrap up? What I'll do is I'll put up, we did promise to share the Hepatitis New South Wales and Multicultural HIV and Hepatitis Service website, so I'll fiddle with this and pop those up. Was there anything else that we needed to?
I don't think so, but feel free to contact us with any questions, either by email or by phone, whether it's just something of a confidential nature you'd like to discuss, or a patient on the ward. Be happy to help.
Right.
Yes, our details will be on the slide.
They will come, hopefully. Here we go. So, is that sharing?
Yep.
Yes. So this is the web address for Hepatitis New South Wales. Lots of great information about hepatitis B and C, and again, Multicultural HIV and Hepatitis Service, which is a really great resource, particularly for hepatitis B and HIV, and has resources in key community languages. This is the Language Matters and the Power of Words resources that we mentioned. Again, great resources around the use of non-judgmental language, so we'd encourage people to check those out. And as promised, our details, so Lisa and Di, again, great resources, and between them cover a large part of CESLID, or all of CESLID. and my contact details are there if any further questions. And that's it from us. So thank you everyone for joining us. That was our first live hepatitis C webinar. Thank you.
Thank you.
Thank you.